Of Indiana County, it's WCCS 101.1 FM and AM 1160, and our conversation with Dr. Michael Sauter, brought to you this morning by Marcus and Mack, a law firm representing injured people. And he's here in the studio with us this morning on this gorgeous day. Enjoy that walk in, did you?
I did. Thank you.
It's a beautiful, gorgeous day out there today. If we could place the operating rooms outside, I'm sure everybody would feel better about that. Dr. Sauter, it is Stroke Awareness Month. We talk with you every year on this topic. But I'm curious, this year, of course, we're 2 years into COVID-19, and studies are going to come out on every medical condition that you can think of, and were they or were they not affected by COVID-19. In terms of people and their propensity for stroke, severity of stroke, how has COVID-19 played an effect on strokes?
COVID-19 has doubled the incidence of strokes among patients in the United States and in Indiana County area as well. What we've also found is that it affects younger people, that is less than 50 years of age, and it affects people in a way that they have larger strokes than are typically seen with first onset strokes. So what we're finding is that there's double the number of patients with COVID who are suffering from strokes. They're occurring at any point in time after COVID infection, that is up to 4 to 8 weeks after infection, and that they generally affect the larger vessels of the brain, causing more disability and more mortality.
Wow. Physiologically, I'm sure the studies will go on and on discovering just why this is occurring, but what are some of the preliminary findings?
What we're finding is that the blood is stickier. And what I mean by that is that an inflammatory cascade is triggered by COVID, causing the blood vessel walls to be stickier and causing the release of inflammatory chemicals from the cells in the blood, both of which contribute to an increased clotting tendency. So we don't see as many embolic strokes from the heart or from the neck, but rather we see much more thrombotic strokes where the blood vessels themselves are just narrowing down.
Is this something that we're going to think of as a temporary condition that is going to solve itself, or is it something that's going to be long-term and affect somebody for a very long period of time in their lives?
Well, the strokes themselves will affect people for a very long period of time. The challenge is whether the enduring aspects of COVID will lead to a higher incidence and prevalence of strokes among our population, because even though we have improved our control of COVID with vaccines and boosters, we haven't eliminated the disease, and hence there will always be that population of susceptible people who will get strokes because they will get infected by COVID.
Well, this is Stroke Awareness Month. Obviously, that's distressing news, but it doesn't mean that there's no hope for stroke victims. IRMC is a primary stroke center, and that means that we have a great advantage here in Indiana County for a rural hospital to attain that title. It means that a lot of people have done some awful hard work in order to get to this point. So let's talk about what people should be doing right now to safeguard their health as much as they can. And if they do feel that a stroke is something that has affecting them in some way, or that they might be having a stroke, what should they be doing?
Yes, the key here is understanding that 80% of all strokes are preventable. An enormous number that unfortunately we don't reduce enough by lifestyle adjustments, by risk factor reductions, and by early presentation to the emergency room. We have a very good emergency department here. We have a very good hospital where the staff is attuned to the management of acute strokes. So the challenge now is getting the awareness on the part of the Indiana population to say, hey, this is something new that I'm feeling. Perhaps I should go into the emergency room and have it evaluated. Really key.
Interesting that you put it the way that you do. Preventing the stroke and the lifestyle changes. What would some of those be?
Better control of high blood pressure, better control of diabetes, monitoring for the development of atrial fibrillation. All of these are age-related risk factors, which means that as all of us get older, we're all more susceptible to these stroke risk factors. And so if we can identify them earlier and be vigilant with our medications and our lifestyle adjustments, we can reduce our own risk of stroke significantly.
And as people who are in their 30s or 40s who aren't controlling those factors now, they have an even higher risk, I would think.
Just because they're accumulating their risk over a longer period of time. And then it becomes much more difficult for them to address the issues later on in life because they have become so entrenched with their maladaptive lifestyle.
In our understanding of risk factors for stroke, we might have some misconceptions. I'm more at risk if I'm exerting myself or if the stresses and pressures of my life are on me. Is that true? Is that a big factor in having a stroke?
Stress is a really big factor to stroke in the sense it increases blood pressure. It increases the release of inflammatory chemicals in the bloodstream. And so these factors, much more than just anxiety, are what contribute to an increased risk of stroke. Overexertion is not typically an independent stroke risk factor, especially if it's incorporated with a vigorous exercise regimen.
So as we understand then what happens when we have a stroke, the recognition factor becomes very, very big. As I've said with you, talked with you before, that puts the onus on everybody surrounding somebody, because somebody who is having a stroke might not have the ability to help themselves. So the people surrounding that person really need to be vigilant and watch out.
Exactly right. Exactly right. I mean, the key is getting to the hospital. And what we try to tell patients is that we are never going to be upset with you showing up prematurely to the ER. It at least gives us that opportunity to address the stroke risk factors that one individual or another carries with them and identify if they need acute intervention. Now, the good thing about Indiana Hospital is that it can provide the clot-busting drug to break apart a stroke in the immediate setting. But what we have also established is the ability to get people into the ER and out of our ER and into a comprehensive or tertiary stroke center where they can actually go into the vessels up to the brain and snare the clot and take it out, so that we can give clot-busting medicines here and we can get them into a comprehensive stroke center where they can actually do what is, for all intents and purposes, just like a cardiac catheterization, although it's a catheterization of the brain where they go in, they identify where the blood clot is, and then they can snare it and pull it out and improve blood flow accordingly. The
speed of the response so important, and obviously the skill that is involved in it as well. And the training that goes into it, it really is a team approach, and everybody knows, okay, what's my role here, and they spring into action.
It's very nice to see how the emergency room, both the physicians and the nursing staff, have embraced the challenges of managing acute stroke, because they have accepted the need for increased training and have applied those training principles so that when a patient comes into the ER, they're managed expeditiously, both in terms of acute care and acute diagnosis, because we can get people into the ER and into the CT scanner or CAT scanner within 15 minutes, and that really allows everybody else to do their job more efficiently, determining whether or not they need that clot-busting drug.
We're talking with Dr. Michael Sauter about stroke. It is Stroke Awareness Month. IRMC is a primary stroke center. Dr. Sauter, there are going to be times when somebody is not able to get to the ER in time. Maybe they have the stroke on their own and are not discovered for an hour or two later, and then they're brought to the ER. The damage can be catastrophic in their lives. Let's talk about what happens after the stroke and the long-term effects, depending upon the severity of that stroke.
Right. And what we have at Indiana Hospital is an acute inpatient rehab facility. It's directed by Dr. Shetty, who is a physiatrist or physical medicine and rehabilitation doctor. And the staff there is focused on early rehab and recovery from the deficits that we unfortunately may not have been able to reverse because of delayed presentation. So we have that aggressive system in place locally where we can tap into our rehab specialists and help augment the recovery.
As we think about stroke and the response to it and the need for us to be on the lookout for it, and as you described, earlier in our lives maybe than we ever have,
Yeah.
and especially now in this COVID era, probably there are some really good things that we should be doing in terms of educating ourselves right now, resources that are out there, and I'm sure IRMC is able to provide those resources.
Yes, IRMC is able to provide resources. It also conducts stroke fairs in which the nursing staff and the medical staff, especially involved with the ER, will have these outreach to the Indiana community and say, look, let's help you to identify your blood pressure. Let's help you to identify whether you have irregular heart rhythms or carotid bruits, which is stenotic flow through the carotid arteries that might put you at higher risk of an embolic stroke. And so the ability for family members to become aware of mnemonics such as Be Fast, to look at the clinical symptoms of stroke and say, hey, I recognize that. I recognize it on some of the billboards around the town. Perhaps my family member is suffering from a stroke because they fulfill those criteria of those Be Fast billboards that we've seen. So this all makes everybody more attuned to the possibility of a new evolving stroke.
Yeah. Okay. So we're trying to educate ourselves and get better at responding to stroke. Meanwhile, for those of us who are in that group that is increasingly, the risk is increasing in us. You mentioned diabetes. You mentioned high blood pressure. These are all things that are controllable in our lives to some extent, and in many cases to a large extent. We need to get involved in that right now. Am I right in saying the first visit should be to your primary care physician to make sure that you're where you are, establish a baseline, and get going from there?
Absolutely. The primary care physicians can perform a risk factor identification and get people started on medicine to control or contain those risk factors. And so they're really the entry into the health system that we advocate, because the primary care physicians here are aware of what we can do down the road and also are aware of what they can do right up front to begin with this identification of health issues.
Yeah. All right. Meanwhile, watch your heart, watch the smoking, watch the drinking, watch the all those different things, lifestyle choices, as you say, that could really harm us in the future. And this is a major way in which that could happen.
Yes, absolutely. What I've tried to do is put together an article for the Indiana Gazette dealing with stroke in the COVID era and identifying some of the factors that may pose increased risk of stroke. But I've also tried to distinguish common misconceptions, and that is influenza and COVID are two completely different infectious diseases, and COVID is much, much more susceptible. COVID patients are much, much more susceptible to death and increased mortality than influenza patients, even though influenza can be a horrible disease.
Yeah. Do me a favor. With that article that you've written, send it to us as well as a computer document. We'll get it up on our news site and get that published so that people will maybe have even more access to it and understand the factors even more.
Sure, I'd be happy to.
He's Dr. Michael Sauter from the Indiana Regional Medical Center. Thanks for the visit.
My pleasure. Always nice to be out here.
It is the voice of Indiana County, WCCS 101.1 FM and AM 1160.